BC's Minister of Health. Tomorrow is Dr. BC's provincial health officer. And wanted to acknowledge that we're here on the territory of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations, and we are honored to be here and grateful to be here. We are, tomorrow, Friday, we'll be providing a written statement with respect to numbers and so on, and updates with respect to COVID-19 in BC. And then we'll be back on Monday in Victoria to provide a regular briefing. And with that, for today's COVID-19 briefing, I'd like to introduce Dr. Brennan.
Thank you and good afternoon. So for today, July 2nd, we have two reporting periods since Tuesday. So between Tuesday and Wednesday, we had 15 new people who tested positive for COVID-19. And then between yesterday and today, another 9 people who tested positive, giving us 24 new cases in British Columbia and bringing our total to 2,940 people with COVID-19. That includes 989 people in Vancouver Coastal Health, 1,553 people in the Fraser Health region, 132 people in Vancouver Island Health, 201 people in Interior Health, and 65 people in Northern Health. We have no new healthcare outbreaks, and we continue to have 5 active outbreaks, 4 in long-term care and 1 in acute care. We now have 626 cases in healthcare settings, which is in 390 residents and 236 staff. We have no new community outbreaks, and the last of our community outbreaks at New World Technologies has now been declared over. We continue, of course, to monitor in all of our community settings, and as we know, we've had a few small transmission events in some community settings and workplaces over the past number of weeks. In addition, we've had a number of exposure events that have thankfully not yet led to additional cases. We have now 160 active cases in the province, of whom 17 people are in hospital and 2 of those people are in critical care or ICU. Unfortunately, we've had an additional 3 people who have died from COVID-19 since Tuesday, and our condolences go out to the families, the friends, and the caregivers of these people, 2 of whom are in long-term care and 1 in hospital here in the Fraser Health region. We have 2,603 people who have now fully recovered. As people know, this summer is phase 3 of our restart plan. Means that all of us need to continue to work together to keep our communities and our province safe. Whether you live in BC, are a visitor from another province, or are in Canada for essential travel, we all have to do our part to protect our communities here, our elders, and our loved ones. Any traveler from outside of British Columbia needs to understand that we have established clear rules for safe social interactions here in British Columbia, and we expect everybody who comes here to adhere to those rules as well. We're calling those our travel manners, and we will include you in that if you come to British Columbia. These include keeping our bubbles small, having gatherings of small numbers of people, maintaining a safe distance at all times, and wearing a mask if we're in particularly indoor spaces or on transit when we can't always keep that safe distance. Staying away from others, no exceptions if you're not feeling well. And like all British Columbians, whether a resident or not, if you develop any symptoms of COVID-19, you need to isolate yourself immediately. You can call 811 and arrange for testing. And anybody who has concerns that they have symptoms of COVID-19 can get tested anywhere in the province right now. We remind anyone coming to BC from outside of Canada that all travelers are required to self-isolate for 14 days prior to interacting with others in our community. And that has been extended, as we've heard recently, from the federal government till the end of August. And we do expect that there is a federal quarantine order for people coming into BC from outside of Canada. there is also a provincial order that we have in place that requires people to self-isolate. As we've had in place for several months, when public health teams are unable to notify everyone who may have been exposed, and we had an exposure event earlier this week, a public alert is issued. And if you are traveling by plane, you also need to pay attention to these public alerts. As we have for many months, we post these on the BC CDC website, and they have several indications of when people may have been exposed to COVID-19 through travel or through other events. There can be no half measures or exceptions when it comes to COVID-19, and we know that in this province, we know that in this country, and we know that from watching what's happening around the world. It requires ongoing monitoring, modifying our activities as needed, and actively managing any new cases that arise, and that is what we are doing in BC, and will continue to do for the coming months. Earlier this week, we announced easing of restrictions for visitors at long-term care facilities and seniors' assisted living residences. We know that after many weeks apart, seniors and elders and their families are eager to be together. Like every aspect of our restart plan, we have to move slowly to ensure that we move forward safely. And for that, sometimes it will mean we need to be a little bit more patient. All of the long-term care facilities in our province are actively working to make sure that they have appropriate safety measures and plans in place so that everybody can have a safe visit. And we know that it may take some days before some of these are ready. Like the restart of restaurants and pubs, once we can see that the plans and processes are working, we can further increase and expand those activities as long as we are able to continue to manage and keep the cases in our community low. With each day that we keep our curve flat, we can take confidence in knowing that the people we care about the most are staying safe. Whether from near or far, everything we do makes a difference here. So let's continue to show that compassion and respect that we have been for the last few months and remain committed to our efforts here in BC. And let's also remember to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry. And I think we were having a few sound problems at the beginning. I think just to make sure people, the basic numbers is 15 cases from June 30th to July 1st and 9 cases from July 1st to July 2nd. We have 17 people hospitalized with COVID-19 in BC, 10 in the Fraser Health Authority, the majority of whom are at Mission Memorial Hospital, and 7 in the Vancouver Coastal Health Authority, and we have 2 people in critical care. On a couple other notes that are of interest, on June 29th, we had 6,263 visits to emergency rooms. It's the first time that number has been over 6,000 since the beginning of March, which shows people returning and using our emergency rooms all over the province. That number, of course, moves around every day, but it shows that both in terms of the surgical renewal, which I'm going to talk about in a second, in terms of emergency room visits, things are back to normal and getting back to normal in our healthcare system. I note, Dr. Henry noted that the outbreak at Renewal Technology in Abbotsford has been declared over, and therefore all of our outbreaks, community outbreaks, have been declared over. And I just think on behalf of everyone in public health, I want to thank both in the cases of where it involved businesses, the businesses involved, and the public health officials for really the excellent work they've done in all those cases. It's obviously a major event in this context when an outbreak is declared, and I think the actions of all of the businesses and all of the health officers have been excellent. Every Thursday I report on our surgical renewal update. As you know, on March 16th we postponed all non-urgent scheduled surgeries. We'll continuing to provide urgent scheduled surgeries, and from March 16th to May 17th in total, we completed 23,536 such surgeries, which is an average of approximately 2,600 surgeries each week. Prior to COVID-19, on average, we performed approximately 6,000 surgeries each week. On May 18th, we resumed non-urgent scheduled surgeries, delivering them as well as continuing to perform urgent and emergency surgeries. 35,174 surgeries have been completed since surgeries restarted on May 18th. Of those 35,174, 27,016 were scheduled surgeries, 8,158 were unscheduled or emergency surgeries. That's in the period 6,532 in Interior Health, 10,038 in Fraser Health, 7,770 in Vancouver Coastal Health, 7,562 in Vancouver Island Health, 1,860 in Northern Health, and 1,412 in the Provincial Health Services Authority. Last week we performed 6,588 surgeries. We had reported last week that was 6,358, but when all of the details were reconciled, it's now 6,558 for the period that ended last Thursday. This week, we are reporting 6,622 surgeries have been completed, which is an extraordinary achievement for everyone involved. That's 4 consecutive weeks, over 6,000 surgeries. That's the most surgeries we've performed in a week. The healthcare system has performed in a week for quite some time, and I really want to express my appreciation to the healthcare workers, the booking people who are involved in scheduling surgeries, on people involved in cleaning operating rooms, for surgeons, for nurses, for health sciences professionals, all of those involved in the process. It is an extraordinary achievement to have continued to move up the number of surgeries we've done while continuing, obviously, this period of pandemic. In addition, as of this week, we've now contacted 55,561 patients to discuss rescheduling their surgeries. That's an increase of 5,400 from last week. And I'd note, because this may be of interest to people, we have, in the contacts we've made, only 1,418 have been unavailable for what are called COVID-related reasons, which would be someone not ready to return or have their surgery because of concerns of COVID-19 and for other reasons related to COVID. That's just over 2% of the total people contacted. So it is, to say the least, a considerable achievement. I wanted to just say finally that this renewal progress on surgeries and in COVID-19 in general should lift us all. It speaks to the remarkable work all of us are doing, all of us in BC are doing to stop the spread. All of us should feel ownership in this success. We may think that the work that doctors, nurses, anesthetists, healthcare professionals do and healthcare workers do in operating rooms is far removed from our lives. And unless we're having surgery or someone we love is having the surgery, that's often the case. But in a pandemic, it is not. In a pandemic, every time we practice the skills that Dr. Henry and public health officials have taught us, we help stop the spread. And when we do that, we help those people in operating rooms do their work. We help patients get the surgeries they need by keeping our hospitals from getting overwhelmed by COVID-19. As we each shape our BC social, surgical, and economic renewal, we are very fortunate to have the tremendous knowledge and skills of public health officers guiding and encouraging us every step of the way. Each day, every day, Dr. Henry and her team keep us informed. They show us how we keep each other safe. In Vancouver Coastal Health, we have Dr. Patricia Daly and her team. In Fraser Health, we have Dr. Martin Lavoie and soon Elizabeth Broden, Dr. Elizabeth Broden and their team. In Interior Health, we have Dr. Sue Pollock and her team. On Vancouver Island, we have Dr. Richard Stanwyck and his team. In Northern Health, it's Dr. John Kim and his team. And in the First Nations Health Authority, it's Dr. McDonald and her team. You saw Dr. McDonald recently talk about all of the successes and all the work done by the First Nations Health Authority. And of course at the BC CDC, there's Rika Gustafson and the whole team there, whose work has been, I think, throughout this pandemic, nothing short of heroic. I want to express on behalf of all the people of BC our appreciation for everyone in public health, all the things we're doing. We got to know many of these health leaders in the health virtual town halls and through special briefings. It's the work of all of them and their colleagues that have helped us get to this point in our BC pandemic, and we are grateful to them. In following their guidance, we've shown that each of us is making a critical contribution to the remarkable progress we're seeing in surgical renewal and in so many other areas. I'd like to say, though, that as we go into yet another summer, the first weekend of July, we have to remain 100% committed, 100% all in to stopping the spread of COVID-19. It's that commitment that makes everything else possible. Thank you very much. Et je vais dire quelques mots en français, et puis on va passer aux questions. Si on arrive à cela, c'est bien. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour deux périodes de référence de 24 heures chacune, soit celle du 30 juin et 1er juillet et celle du 1er juillet jusqu'au 2 juillet en mi-journée. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19, dans la régie de santé de Fraser et 2 dans la régie de santé de Vancouver Coastal, pour un total de 177 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Pour la première période de référence qui s'étend jusqu'au 1er juillet, nous avons eu 15 nouveaux cas. Au cours des dernières 24 heures, 9 nouveaux cas se sont ajoutés. Cela représente 24 nouveaux cas depuis notre dernière mise à jour mardi, pour un total de 2,940 cas en Colombie-Britannique. And I'd just like to say finally that we lost 3 people to COVID-19 from June 30th to July 1st. And, you know, often we talk about flattening the curve and achievements such as the achievements we've had in surgery today, but this is losing people at this time in these difficult circumstances is the hardest thing you could imagine for families, for caregivers, for friends, for communities. 2 of those people passed away in the Vancouver Coastal Health Authority in long-term care, another in the Fraser Health Authority. We are thinking of them today, and all of those who have lost people during this pandemic. It is something we should always remember. There's impacts on whole communities, and we've seen that. But the impact of those who have lost loved ones during this time is something to be specially recognized. We acknowledge their grief, and we join them in their sorrow. Thank you very much. Dr. Henry and I are happy to take your questions.
Thank you, Minister. And before we take questions, a few reminders for the media on the phone. Please press *1 to line up for questions. We will take 1 question and 1 follow-up at this time. And please keep your phones unmuted. You will not be audible unless I call your name.
Do you want me to read the numbers again? Or
Yes,
okay?
please. There was a little bit of an audio issue in the beginning, so Dr. Henry will go through the numbers again. And the first question will be from Keith Baldry. But before that, Dr. Henry, please go ahead.
Sure. Just so we have 2 reporting periods from Tuesday to Wednesday. We had 15 additional people who tested positive, and then from July 1st to today, an additional 9 people, giving us 24 new people who've tested positive for COVID-19 in BC, and that brings our total to 2,940 in British Columbia, 989 people in the Vancouver Coastal Health Region, 1,553 people in the Fraser Health Region, 132 people on Vancouver Island Health Region, 201 people in Interior Health, and 65 people in the Northern Health Region. We then also continue to have 5 active outbreaks in our healthcare system, 4 in long-term care, 1 in acute care. And as we mentioned, we have 160 active cases right now, of whom 17 people are in hospital, 2 of whom are in critical care or ICU. And we've had an additional 3 people who have died from COVID-19, as well as 2,603 people now fully recovered.
Thank you, Dr. Henry. And the first question is from Keith Baldry, Global. Keith, go ahead, please.
Thank you, Dr. Henry and Minister Dix, for taking my question. Dr. Henry, there's been a number of articles and research done around the world that even when people supposedly recover from COVID-19, they are inflicted with various lifelong scars of various sorts. I'm just wondering what BC's experience has been. We list these people as recovered, but do we have examples of people who are left with some very serious medical issues after being labeled recovered?
Yes, we do, and I don't have that quantified right now, but we've come to learn that this virus affects many different systems in the body. We know that one of the receptors that it binds to is what we call an ACE2, angiotensin converting enzyme type 2 receptor, and we know those receptors are on our heart muscle, in our blood vessels, in our lungs, in the back of our throat, and that's how the virus can get into the body. But we know that those also have an effect on different organ systems. And so yes, what we are seeing are that there are things like clotting effects that people can have for a period of time. We know that there is some cognitive effects, that there have been people who've had small strokes related to infection with the virus. There is often a confusion that we don't know of exactly because it's from infection or whether it is exacerbation of the immune system causing cognitive dysfunction over time. So there has been reports of that as well. So these are all things that we have seen. I mean, very basically, the virus infects the lungs as well in many people, and you can have ongoing scarring and challenges with difficulty breathing. And really what we hear the most is profound fatigue that takes a long time to get over. We have a number of processes in place. There are a couple of clinics to follow up people who've been tested positive and had illness, particularly people who have been hospitalized, because they are people who tend to have more prolonged illness. We also have a number of research projects that are looking at following up of people in both here in BC and as part of both national and international follow-up projects. So I don't have the details of those now, but I know that there's the clinicians are looking at how we can pull together the results that we've had here. Thankfully, a relatively low number of people here, but putting it together with colleagues across the country. The other one that is incredibly important that we've established early on was following people in pregnancy who become positive for COVID, and following both mums and the babies that are born. And Dr. Deb Money has been leading that across the country, and we've been participating in that as well. So yes, these will come as the evidence accumulates over time, and I know that some of these will be published soon.
Do you have a follow-up, Keith?
For that detailed answer. Mr. Dix, your fellow Vancouver Kingsway political colleague, MP Don Davies, is calling out Transport Canada for being, in his words, negligent for not following social distancing rules. Recently, 3 flights into YVR, passengers were warned they may have come in contact with COVID-19. Do you think Transport Canada should take a harder or firmer role here in ensuring that those distance rules are applied?
Well, as you know, Keith, we heard from Dr. Teresa Tam on Tuesday, and Dr. Tam said very similar things to what Dr. Henry said and what I said. If you'll remember, I think it was around page 25 of our May 4th briefing on the modeling, we talked about a hierarchy of measures that can be taken, and at the top of that hierarchy is physical distancing. So physical distancing is something that we preach here every day. Physical distancing saves lives, and it's important wherever you are. What's also important, given that the airlines have pursued this initiative and that these initiatives from Transport Canada are voluntary, what it tells us if we have less physical distancing is the absolute need for people who go on airplanes to be disciplined about all of the other things they do. And that's part of the message we want to emphasize today. These are decisions in federal jurisdiction, but there are things that we can do to be safer. Those include, of course, using masks. We know that. We also know that it's more important to keep your hands clean. It's more important not to touch your face. It's more important to be concerned about surfaces. It's more important, in fact, to be conscious of everything else. And this has been part of our message from the beginning. In those instances where physical distancing can't be maintained, the message isn't that, oh, well, it can't be maintained. The message is that should make everything else we do more rigorous. And that's what's happening on airplanes right now. And there can be a debate about that. But I think the important thing is for everyone who goes on an airplane to be conscious of following all of the other rules and applying all of the other rules so that they stay safe, the people around them stay safe, and obviously all the people they love, all the people they'll see wherever they're arriving in their destination stay safe. So our view of physical distancing as an important protection against COVID-19, of it being on top of that hierarchy. If you remember the downward triangle that was presented at that time, and was presented at the time we launched our restart plan by the Premier and Dr. Henry, that continues to be the case. Physical distancing is very important. We need to maintain it wherever we can, and when we can't, if that's on an airplane or anywhere else, we have to be more conscious of all of the other things we need to do, such as washing our hands, such as not touching our face, such as wearing masks, and so on.
I will just add to that there are two things that I think are really important, air travel, that we've seen happen again in the last week, both here in BC and across the country, and that is being fastidious about not allowing people with symptoms on aircraft, and that's something that's a shared responsibility between the airlines and people who are traveling. You cannot travel if you're sick or if you've been in contact with somebody with COVID-19. And we have had that happen here in BC, we've had it happen in Nova Scotia, we've had it happen in other places. So that is something that is incredibly important. It's what protects us on aircraft. And the other thing that is would be helpful for us in public health when we try and contact people is if we do find somebody who has been ill on an aircraft or who develops symptoms within a period of time, we know that people can shed this virus before they show symptoms themselves. Being able to efficiently contact those people on that aircraft, and it's still a challenge to get contact information that allows us to connect with people in an effective and efficient way, and that's why we are so conscious of posting the flight numbers as well so that people know.
Thank you. The next question is from Shannon Waters, BC Today.
Hi. I've seen another couple of calls from groups who are concerned about BC's efforts at procuring personal protective equipment at this point in time. I know we get the updates on Tuesday, but I'm again wondering if what BC has managed to procure over the last few weeks has changed the pandemic allocation framework for PPE for frontline workers who are still treating people with COVID-19.
So the guidance for people who are treating people with COVID-19 remains the same as it always has been, which depends on what you're doing, what the situation is, what the person's presenting with. So obviously, if we're, what we're talking about is wearing a surgical mask, eye protection, glove, gowns for most interactions. If you're doing aerosol-generating medical procedures, then it includes eye protection, a respirator to help filter out particles, as well as glove and gowns and all the other important things. So there's a number of things. We talk about the hierarchy of needs, or the hierarchy of personal protective equipment, and how we protect people. So there's a number of administrative and other things that go with that. But in terms of PPE, for people who are assessing and treating people with COVID, the standards are the same. In terms of the type of PPE we get, I'll ask the Minister to talk about that.
Well, I think you referred to it. Shannon will be providing another detailed briefing at Monday's session on this, but I think I don't think there's a jurisdiction in Canada that, and this is really work led by the Provincial Health Services Authority and by officials of the Ministry of Health, has been as successful in procuring PPE in this period. It's been an extraordinary effort principally led by our provincial officials, and you see that in the results every week, the millions of N95 or equivalent respirators, but all the other PPE and equipment that we've been able to source. Obviously, we're all with the federal government on domestic production of PPE, which I think in the long term remains important. So we're going to continue to work with them on those questions, on being able to source PPE, not just in the international market, but developing domestic manufacturing for PPE. That's important to our partners in the federal government. It's important to us, and we're making progress in that regard. I think first with surgical masks or medical grade masks and gowns, and later on in eye equipment. And then we're making progress, but it's slightly longer term in terms of developing sources of N95 or equivalent respirators here. So I think we're making progress, and I think the achievement in terms of getting the amounts of PPE we've been able to get from places around the world is really an extraordinary achievement of officials of the BC health system.
Shannon, do you have a follow-up?
Yes, please. I was hoping for an update as well on disaggregated data for people of different ethnicities, racial minorities here in BC. Is that something that might be part of the next modeling update or epidemiological data update that we get?
Yeah, so as we presented the data on First Nations and the connections that we had with the First Nations client file to be able to understand that particular impact in First Nations in BC. As I've mentioned, we have not systematically collected case report information by disaggregated by race or ethnicity. So we do not have that, but we have collected that information in the survey that we did, and we are analyzing that now. It's taken some time, but we will have some information absolutely about the impact both of COVID, but also of the measures that have been put in place in BC on a variety of different measures, including disaggregated by ethnicity and race and socioeconomic status and a few other things. We have had agreement going forward on collecting more detailed disaggregated data on cases. So that will be starting, but we have not yet gone retrospectively because it was not collected in a systematic way back to January.
Thank you. Next question is from Zara Premji, CBC. Zara, go ahead, please.
Thank you. Hi there, Dr. Henry. So my question for you is, do you share Premier Horgan's concerns about allegedly Alaska-bound Americans making unnecessary stops in places like Port Renfrew, which seemingly is a violation of the CBSA guidance?
It is. You know, I think we need to put things in perspective. I know there's huge sensitivities around the province, and for very good reason. We've done a lot here, and it has been a sacrifice for everybody in this province. And so there are concerns that people are coming in from jurisdictions that are still very much at risk from this virus, and we have seen people with concerns. I will say that you know, from understanding with talking with our Border Services Agency and others, that the majority of people with U.S. license plates who are in BC are Canadians who have returned home over the period of the last few months. We have seen individual reports of people who are using that Alaska loophole, if you will, but I understand as well that they are very small in number, and that they are subject to the federal quarantine order, and there is very strict direction on what they should be doing, and that is, as we know, up to the CBSA, and also the enforcement of those orders is through our CMP and police services. So I know they have been involved in some cases in ensuring that people are moving along as they are supposed to do. But it is a challenging time, and I know we are all very anxious and concerned about people who may put our communities at risk, and I think we need to take a step back and do what we've been doing all along, which is have some compassion and be calm about it, recognizing that we may not understand everybody's situation, and that is how we are going to get through this. And to those people, and I talked about it today, who are coming through our province, recognize that we have a vested interest in making sure that you follow our travel manners as well. And we need to help people understand what those are in a calm and in a kind way. And that's how we'll manage for the next few months.
Thank you. Follow-up, Zara?
Yes, I would love to get that as well in French, please.
Oui, juste pour dire que c'est absolument essentiel pour tout le monde en Colombie-Britannique qu'on garde nos gains contre COVID-19, c'est-à-dire qu'on continue à rester ferme sur la question de la frontière, bien entendu, on veut que les restrictions qui sont en place actuellement continuera à être en place dans les mois qui suivent. Donc, on va continuer à travailler sur cette question avec le gouvernement fédéral. Il y a quelques gens qui traversent la frontière en disant qu'ils ont l'intention d'aller en Alaska, et ça c'est un problème, c'est un problème mineur, mais c'est quand même un problème. Il faut aussi reconnaître qu'il y a des gens qui ont des licences des États américains, mais qui sont canadiens, ou des Américains ou d'autres qui étaient ici avant la déclaration de la pandémie. Donc, il ne faut pas prendre des conclusions personnelles dans chaque cas, mais je sais que le gouvernement fédéral travaille fort sur ces points pour assurer que la loi soit appliquée ici en Colombie-Britannique et partout au Canada. C'est important. Donc, on continue ce travail, mais c'est absolument important que la limitation sur les visites au Canada continue, et on travaille fort là-dessus, y compris entre le Premier ministre John Horgan et le vice-premier ministre Chrystia Freeland.
Thank you. The next question is from Brishti Basu, Victoria Buzz.
Hi, thanks for taking my question. Dr. Henry, do you have any more details about the new case in the Vancouver Island Health Region reported today? Can you tell me if it's part of an outbreak and what day it was reported?
That person was reported on June 30th, and it is somebody who is a travel-related case, so not related to anything, any local outbreak or cluster.
Follow-up, Brishti?
Yes. Will there be a public exposure alert, and can you also tell us what part of the island it was detected in?
I don't actually have that, and it will depend on when the person traveled, whether there would be an exposure alert or not. As far as I understand, they had a small number of close contacts that are in quarantine now, so I don't believe there was any concern about travel.
The next question is from Lisa Cardasco, CHLY.
Thank you, Dr. Henry. I'm just wondering, the cases that we're seeing, related to the Mission Hospital, was this a case where somebody from the hospital then exposed others who were in care homes? And if that is the case, does that sort of deserve a rethink on whether hospital workers should be working anywhere else in the same idea of that, single site?
Yeah, so the Mission Hospital one is a complicated cluster. What we do know is it was detected because 2 patients from Mission were transferred to long-term care homes. One is the Tabor home and the other was the Maple Hill. So they were the only people who were transferred, and both of them became sick once they were at the long-term care home, and it was traced back to their exposure being both at Mission Hospital. So there are now additional cases that have been uncovered as the investigation happened at the Mission Hospital. So it wasn't healthcare workers moving between the hospital and long-term care. It was patients who were transferred and then recognized to have been exposed at the Mission Hospital. And we now have additional cases in both patients at the hospital and healthcare workers. And we believe it was linked back to a previous long-term care outbreak. But that investigation is ongoing with Fraser Health right now.
Do you have a follow-up, Lisa?
Yes, thank you. Wow, that's an incredible tale of transmission. But the other question I'd like to ask, the all-party committee that will review the BC Police Act will be named next week, according to the Premier. Will you make a presentation before that committee regarding your recommendations of changes to the Police Act that you made originally in your report on the overdose crisis?
I have not been invited to present to that committee. I'm certainly available to do that should they wish to discuss those issues. Have made my concerns known, as you know, and have been talking with a number of people about some of the things that could be part of that revisions of the Police Act. So I would be perfectly willing to provide those in either a public or private way to the Commission.
Thank you. The next question is from Marcella Bernardo, News 1130.
Thank you, Dr. Henry and Minister Dix. I was hoping to ask you more about border control because I thought I heard you say earlier on today that that quarantine measures are going to be in effect until the end of August. But are you concerned that the border restrictions are not going to be expanded past July 21st?
My understanding was that those restrictions have been extended by the federal government until August 31st now. So that is something that we do support. As we know, we have great concerns about what's happening south of the border. Obviously, we want things to get better, but right now it's a challenging situation in Washington State where they have been actively working for, as we know, a long time to control the outbreak there. I think it really speaks to once you get a level of transmission in the community with this virus, it is so challenging to get ahead of it. And, that is one of the things that we've been able to do here in BC early on with the testing that we had. And of course, here in Canada, we seem to be managing it. But we know that there is still risks, not only from the U.S., but from other countries around the world where there continues to be challenges in managing this outbreak. So I just heard the announcement today, so I don't know all the details of it, but I understand it's been extended till August, which we think is important and a good thing to do. And what we need to do is ensure that essential workers, who we know there are many essential workers who do come across our borders and who we need to, whether it's through bringing supplies or food or ensuring that we have the things that we need to keep businesses going. So those are things that we need to continue to monitor. We have shown through our modeling that we are in a fine balance here, and that's allowed us to do things like ensure that we can still protect our long-term care homes and have visitors, and all of the things that we're doing in our community. So making sure that we don't have lots of introductions from places where people are at risk is important for us. It's also important, and we talked about this a little bit, how we manage those cases. So that's the minimize. We want to minimize the numbers of new cases, and part of that is ensuring we have appropriate border controls. We want to be able to manage every single new case, and the detailed traceback that we do of every single case in public health is really, really important, and that helps us understand where this virus is moving in our community. And part of that is people who are in the province under the quarantine order, following up on them, which we continue to do, making sure they have a valid self-isolation plan, making sure that we are continuing to call them on a daily basis or a periodic basis, that they're following those plans, and making sure that anybody who develops symptoms gets tested. So we are continuing to do that as well. I think about our temporary foreign workers. We've had a number of people who've tested positive recently come in from other countries for those essential services. And how we're managing that is the best way that we can to protect our communities here.
And I think you know this, that there's what the federal government has done, I think, in the last number of days is extended its order of quarantine for anyone returning to Canada or coming to Canada who arrives here until August 30th. That's all visitors. That doesn't just involve the United States of America. There's an existing also and joint agreement that gets renewed monthly that's currently reviewed in place up to July 21st. It would be our expectation, our advocacy, our belief that that should continue to be extended, that there not be visitors from Canada to the United States or vice versa, both of which are important to us. Remember that it's both cases of people going from Canada to the United States and then returning. That would be a problem at this time, and visitors coming from the United States. So it involves both Canadians and Americans. And simply put, certainly at this time, notwithstanding the real impacts of those controls at the border and those controls internationally, they remain absolutely essential to our efforts to control COVID-19 in BC. So we are happy that the federal government extended its order until August the 30th, I think, today, and are of course hopeful that they'll continue to extend their order with respect to visitors back and forth from the United States and Canada. That ends July 21st. At present, doesn't end, but it was extended to then. We're hoping that it be extended for, of course, another month and beyond that.
Follow-up, Marcella?
Yeah, just to ask Dr. Henry, we ran some stories yesterday about WorkSafe BC receiving more than 1,600 complaints about public safety issues linked to this pandemic, and that's resulted in 62 orders as of June 26th. How concerned are you that big box retailers like Costco and other big corporations that are allowing people into their stores are actually following the rules? Because there have been crowd control issues in these big box stores.
Yes, and I hear of complaints as well, and I know it's been a joint thing with WorkSafe BC, but also public health in certain settings as well, like our recent exposure event at a club here in Vancouver, restaurants, etc. So they are being inspected. We are making sure that those plans are being adhered to. And when people complain, whether you're a worker, you can complain, you can make your concerns known to WorkSafe. If it's a member of the public, you can contact your local public health authority and they will investigate. They do it on a priority basis depending on the risk of the environment, and they've been doing they've been doing some priority proactive investigations and inspections as well. So this is how we are going to have to keep ourselves accountable as we move forward in this. So I encourage people to go to the website, find the plan, or make sure if it's a smaller place that you can look at the plan that people have posted, because every business must have a COVID-19 safety plan. When the legislature reopened a week and a bit ago, the Ledge has a plan for how to ensure that we maintain the safety measures that we need and the business of government can restart. So those are the way that we keep people accountable, and if those plans are not sufficient, WorkSafe BC has provisions, and we in public health have provisions as well to help get people back in line.
Thank you, and we have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later today. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Office's orders, visit gov.bc.ca/PHO guidance. And our last question this afternoon is from Rob Monroe, InfoNews. Rob, go ahead, please.
Hi, Dr. Henry. Thanks, Sue. I just wanted to get back to the earlier question about the after effects of COVID. People have fully recovered. And I think you said you can't quantify the numbers, but do you have any idea of sort of proportion of people that have these after effects? And do you have any information in terms of the age? I'm thinking in terms of younger people not getting that sick. Are they possibly having some of these lasting effects?
I'll have to get back to you on that, and that is something that we've been following, but I don't have data that I can look at right now, but I can ask for it, and I know there's a number of different clinical groups that are looking at this, particularly, people who are in ICU, people who have been in hospital. We do know that most of the people who are not hospitalized, don't need ICU care, do recover fully quite quickly. But I can get back to you, and I think that is an important thing for us to present some data on. So I'll look at doing that in the coming weeks.
Thank you. Do you have a follow-up, Rob?
No, I'll leave it at that. Thank you.
Thank you all for participating.
Thank you.